This is Day in the Life, part of a series of videos showcasing the amazing diversity of health-related jobs. In these interviews, we'll hear a little bit about what a day in the life of a health professional may look like. We will explore careers related to health in the military and industry. Can you tell us what are some of the most important things you did on a regular basis or day-to-day basis as a physician in the military?
Sure. I think first and foremost, taking care of our servicemen and women and their dependents. That's a huge honor and it's a privilege and it's a really unique population. Secondly, in the military, there's a lot of opportunity to set standard of care. You get to work with big leaders within a national organization and help determine what the best course of action is for that organization to make sure that the standard of care is met across the entire DoD. And that's a really big privilege and I think a really important job that you get to have as a medical provider.
So as a healthcare provider in the military, how do you impact people on the ground?
So there are a couple different ways that happens. One, there's the obvious way. There's those patients that are at war who are a wounded warrior who are acutely injured. They're involved in a blast or a gunshot wound, and there are providers that are right there immediately to take care of those individuals. Those individuals usually then are taken to a combat unit where they're taken care of, where there are medical providers, doctors, nurses, corpsmen, and then they can be air-vac'd out to a higher echelon of care. Providers are needed on that air-vac, whether that's a helicopter or an airplane, and then providers are needed at that higher echelon of care. Furthermore, there needs to be a standard of care set at the time of initial evaluation. So there could be either protocols that are written to help deal with those acute trauma situations, or there may be simple questions like how to deal with acute bleeding from the uterus. If somebody is having, let's say, heavy periods, we may help deal with those situations, deal with things like birth control, deal with ectopic pregnancies. So it's a pretty broad and non-specific set of skills that are needed, and I think that really any profession or any subspecialty really can contribute.
Thank you so much for being with us today, Whitney.
Thank you.
How do I impact health in terms of my current role in the industry? Well, the fact is that many industries touch patients in very profound ways. So my job really is to bring patients into everything that we do, to make sure that our research, that our products, that the services we wrap around our products are all focused on improving patient outcomes. And for many people, it might seem like this is an obvious thing that we would want to do, but it's very helpful to have a person who's very focused on that and really brings that in. And so when I think about what I try to do as a physician, it is really in many ways to be the person who makes sure we really are taking care of patients and that the products that we're producing as well as the services that we use to help support patient use of those products are really having the desired impact and really are improving patient outcomes.